Cephalosporins. Beta-lactam antibacterials is penicillin, broad-spectrum antibiotics, originally derived from the fungus Acremonium, which was previously known as Cephalosporium. Mechanism of action: inhibit cell wall synthesis in a manner similar to that of penicillins and Bactericidal. Common indications: urinary tract infections, biliary tract infections, meningitis, peritonitis, pneumonia, septicemia. Side effects can be classified as common, uncommon, and rare side effects. Common side effects are abdominal pain, diarrhea, dizziness, eosinophilia, neutropenia, leukopenia, thrombocytopenia, nausea, headache, vomiting, and uncommon side effects are anaphylactic reaction, antibiotic-associated colitis. Rare side effects are agranulocytosis, angioedema, nephritis tubulointerstitial, reversible severe cutaneous adverse reactions, scars. Types of cephalosporins: first generation, second generation, third generation, fourth generation, and fifth generation. First generation cephalosporins are Cefalexin, Cefradine, and cefadroxil. Second generation cephalosporins are cephadroxil and Cefaclor. Third generation cephalosporins are Cefixim, cefotaxim, ceftazidime, ceftriaxone. Fourth generation cephalosporin is Cefipim, and fifth generation cephalosporins are ceftaroline and ceftobiprole. Special points on 1 and 2 generations: the orally active first generation cephalosporins, Cefalexin, Cefradine, and cefadroxil, and the second generation cephalosporin, Cefaclor, have a similar antimicrobial spectrum. They are useful for urinary tract infections, which do not respond to other drugs, or which occur in pregnancy, respiratory tract infections, otitis media, and skin and soft tissue infections. Cefaclor has good activity against H. influenzae. Cefadroxil has a long duration of action and can be given twice daily. It has poor activity against H. influenzae. Ceftriaxone is less susceptible than Cefalexin, Cefradine, cefadroxil, Cefixim to inactivation by beta-lactams. It is therefore active against certain bacteria which are resistant to the other drugs, and has greater activity against Haemophilus influenzae. Special points on third and fourth generations: orally active third generation, Cefixim has a longer duration of action than the other cephalosporins that active by mouth. It is only licensed for acute infections. Cefotaxim, ceftazidime, and ceftriaxone are third generation cephalosporins with greater activity than second generation drugs against certain gram-negative bacteria. However, they are less active than ceftriaxone against gram-positive bacteria, most notably Staphylococcus aureus. Their broad antibacterial spectrum may encourage superinfection with resistant bacteria or fungi. Ceftazidime has good activity against Pseudomonas. It is also active against other gram-negative bacteria. Ceftriaxone has longer half-life and therefore needs to be given only once daily. Indications include serious infections such as septicemia, pneumonia, and meningitis. The calcium salt of ceftriaxone forms a precipitate in the gallbladder which may rarely cause symptoms, but these usually resolve when the antibiotic is stopped. Contraindications: patients with cephalosporin hypersensitivity. Cautions: patients with sensitivity to penicillin and other beta-lactams, immediate hypersensitivity should be avoided. Cross-sensitivity with other beta-lactams: about 0.5 to 6.5% of penicillin-sensitive patients will also be allergic to the cephalosporins. If a cephalosporin is essential in patients with a history of immediate hypersensitivity to penicillin, because a suitable antibacterial is not available, then Cefixim, cefotaxim, ceftazidime, ceftriaxone, or ceftriaxone can be used with caution. But Cefaclor, Cefalexin, Cefradine, cefadroxil, and ceftaroline should be avoided. Pregnancy, renal impairment, and hepatic impairment: cephalosporins are excreted by the kidney, and the dose should be adjusted in severe renal insufficiency, and in hepatic impairment, safe to use in pregnancy and breastfeeding, may cause loose motion in the child. Interactions: increased nephrotoxicity with aminoglycosides, increased anticoagulant effect of warfarin, reduced absorption by antacids, inactivation of oral typhoid vaccine. Patient advices: do not miss doses, take doses at evenly spaced times. Inform if diarrhea develops which becomes severe or persistent or contains blood or mucus, either during or after recent treatment. Inform the doctor if any previous allergy to penicillins. Practice points: cephalosporins penetrate the cerebrospinal fluid poorly, unless the meninges are inflamed. Cefataxim and ceftriaxone are suitable cephalosporins for infections of the CNS, example, meningitis. Rapid IV administration of large doses may result in seizures, especially if inappropriately high doses are used in renal impairment. Cefataxim is preferred to ceftriaxone for gram-negative septicemia in neonates, as ceftriaxone displaces bilirubin from albumin and may increase risk of bilirubin encephalopathy. However, a single dose of ceftriaxone is used to treat neonatal gonococcal conjunctivitis. Thank you. See you in the next video.